Good afternoon and welcome to the County of Berks media event on Wednesday, January 13th. And today, our subject is going to be the mid-action report as to the COVID pandemic and where we are, a status update from our Department of Emergency Services. You will be able to have this available on the county Facebook page, the County of Berks Facebook page, as well as BCTV. At this point, I'd like to call on my executive assistant, Jessica Blauser, to read the requirements for submitting questions. Jessica?
Comments or questions must be germane to the topic being discussed and include your full name and the municipality where you reside. If you are from the media, please put your name and who you are with. Non-media participants, please limit your questions and comments to one per person.
Thank you, Jessica. So this week's update will feature a presentation on the Berks County Department of Emergency Services COVID-19 Mid-Action Review. We will be joined by Brian Gottschall, our Director of Emergency Services, and Matthew Steriker, Assistant Director for Emergency Management. The Mid-Action Review provides a retrospective on the community's response to the COVID-19 pandemic thus far to evaluate the current situation, highlight what was done well, and identify areas of improvement. As part of the review, the Department of Emergency Services conducted a survey of community stakeholders for their feedback and received about 140 responses. The Mid-Action Review is available on the County Updates page of the Do Your Part Berks website. This press event will be streamlined live again to Berks County through our Facebook page as well as BCTV. We're normally joined by our fearless leader and chairman, Commissioner Christian Leinbach, but in this virtual reality world, he is having some connection problems. So at this point, before we enter into the introduction of the panel, I'd like to call on my colleague, Commissioner Michael Rivera, for any comments he'd like to make before we start the program. Good afternoon, Commissioner Rivera.
Yes, good afternoon, Commissioner Barnhart, and thank you to all of those who are watching us. I want to first of all thank Brian and Matthew for their job in putting this together. As you can see, there were almost 140 responses from different key community sectors, including county departments, municipal government, law enforcement, fire, EMS, long-term care facilities, and other community organizations, as well as educational institutions. So there were a lot of community sectors here, a lot of stakeholders involved in this, and the feedback we got was really, really good, and that's why we want to make sure that we're sharing this information with you, making it public, so we can take what we've learned and apply it now. We're not done with COVID yet, and apply it to what we're doing right now with COVID. So I'm really interested in Brian and Matthew being able to share this information with you. It's excellent information, so thank you for being here.
Thank you, Commissioner Rivera. I too want to thank and praise our Department of Emergency Services who have been working around the clock 24/7, and that's not being facetious, that's being honest. They never sleep when it comes to emergency services, as well as getting knees deep in the COVID-19 pandemic. And it's really good to have a mid-action review, and then of course at the end of everything, a final report. But it's good to know where we're at, kind of a temperature in the room kind of thing, what went well, what continues to work successively well, and those areas that needed improvement. You never want to fly in the blind, you never want to fly into the fog without the proper radar. So this is really a good way for us as community leaders and all the other groups that were asked to respond, did a very exhaustive research, and at this point would like to call on Brian and Matt to go through the presentation and the intended purpose, the impact, who the stakeholders were, public outreach, and responses. So certainly we welcome everyone's questions. If you're from the media, obviously identify the media, and from the general public. And again, this will be available on the Do Your Part Berks website for anyone who wants to read it on the computer or download the significant amount of paper it will take to read this report. So good afternoon, everyone, and welcome Brian and Matt. Take it away.
Thank you, Commissioner. Thank you, Commissioners. I really appreciate the opportunity to come here in this venue and deliver this. The report is actually on the Do Your Part website already. It's been out there since Monday when the media release was sent. And certainly we could have just released it and sent emails to everybody telling them that it was there. But this opportunity, or this venue, gives us an opportunity to kind of contextualize some of it, provide some extra comments or thoughts that might not be able to be incorporated into the document itself, and of course open the opportunity up for our public to ask some questions about it. So it's great that we get the chance to release this document in this way versus just kind of putting the pack of papers Commissioner Barnhart said out there in the world. As the commissioners mentioned, Matt Steriker, my Assistant Director for Emergency Management Services, joins us today, and he is here to prop me up because he and his team did the lion's share of the work in collecting this data, working with the stakeholders, and preparing the report that we're going to talk about today. And I guess since I get the director title in the department, I'm the guy that gets to be the talking head delivering it to you, but he is the subject matter expert and is available in the event that there are specific questions that come up that are beyond my ability to answer because they relate to the process or things that they experienced while they were undertaking the process. And the last comment I'll make before I get into the review presentation is that while I certainly appreciate the comments the commissioners made about myself and even in referencing Matt, this effort truly was an effort of many. There are all of the folks who work in the emergency management group in the Department of Emergency Services were very involved in the preparation of and development of this report and its subsequent release. So I'm very appreciative of all of them and their hard work in making sure that we have this available. So the commissioners kind of already stole a little bit of my thunder in some of the comments that they made, as I anticipated that many of our viewers today would not necessarily know what an action review is. And I'm differentiating mid-action from others, and we'll talk about why in a minute. So I do want to just give a little bit of background and talk about kind of why we got here, why we're where we're at today. I want to make clear, though, that the report is available at the Do Your Part website. The link is shown on the screen, and I'm sure that our IT folks will put it in the comments and such on the social media platforms like they always do. And I want to emphasize that while we appreciate the opportunity to give this presentation today, we hope that no one will watch this presentation and believe that they've heard it all or understood the concept of the report, because this really is a high-level delivery of what we hope is a good and comprehensive report for the public. So please do go to the website and download the PDF or print it if you like to do it that way, and look at the report in addition to watching this presentation. So step one is to understand what an after-action review is. And this is a term that is more familiar to folks who may be watching in the emergency services because it's something that's very commonplace in our world. When I got involved in the emergency services in the late 80s, early 90s, we called this an incident critique. And incident critiques were all kinds of sizes. Sometimes it was just a couple people sitting down after a call talking about what went right and wrong. And other times you got a lot of people from different agencies and stuff in the room in order to talk about what it was that went on. The term critique kind of went out of vogue as we got a little bit more sensitive in our society and nobody wanted to hear that they were being critiqued. So we began calling these after action reviews and recognizing that it's not just about looking at what was problematic and how to change those things and highlight those weaknesses, but also how to build on the strengths. So this is a very normal thing that happens in the emergency services. This incident, and you'll hear me use the term unprecedented numerous times throughout this presentation. I'm sure you've heard it on the news and everywhere else in the world. It keeps getting used over and over again for COVID. That's because it really is unprecedented. So we've never done a critique, a review on an incident of this magnitude. So it was a little bit of uncharted territory for us, but we felt it was important to at least begin down the road. And then we get to the question of, well, okay, why are we calling this a mid-action review? And I hope that the answer to that is obvious to everyone. Because this response is so protracted, because it is so unprecedented in scale, and it really ended up being like two responses, where we had what started in the late winter, early spring, and proceeded on into the late spring, early summer. And then, while by no means did the problem go away, and as we're going to hear, for some organizations, it actually got worse over the summer. For many of us, we saw the summer months as a respite or a lull in the response, and then saw things begin to pick up again in the late fall as we got into winter. So really, we were looking at this as we began to conceptualize it as a mid-action review about how we could do a retrospective on what had been done to date in an effort to kind of improve or to reinforce what was being done previously in this second wave as we get into 2021. And that's really the focus of this document. Primarily, what can be done right now to improve the situation moving through 2021 until hopefully the end of COVID, the end of the COVID response as we currently know it, sometime in the middle to third quarter of this year as we see vaccine rollouts. So again, we wanted to improve, but we also wanted to make sure that we were offering opportunities for improvement to other stakeholder entities that were involved in this process. It began, of course, as just looking at DES, and then we started looking at some other counties, or I'm sorry, other county departments. But then we also said, well, geez, is there anything that can be learned here by the community as a whole? Can someone reading this document or understanding the types of questions that we asked about our own operation utilize that information or utilize the concept to improve themselves? Because DES or even the county of Berks is not the solution to the COVID problem. This is more than anything else we've ever dealt with, a community as a whole response. It's funny because just today, both in a media conference with Dr. Levine at the State Department of Health, as well as in an email that I received from another public safety leader, twice in one day I saw people reference that one of the biggest things that we learned about COVID is that we're all so interconnected, and it really is all about what all of us do for each other. So we really wanted that to be reflected in this mid-action review response. And we saw it as an opportunity for those folks that are knowledgeable about social psychology or even management theory. There's a concept called the Johari window, and I'm not going to try to teach you a class here. You can Google that if you're interested in it in a little bit more depth. But basically, the Johari window concept has to do with trying to look at yourself or your operation or the way that you do things from multiple perspectives, not only how you see things, but how other people see you and how you see how other people see you. So again, I'm not going to spend a lot of time on the Johari window concept, but it's really central to what we tried to do here, to look at not only what we saw inside as what went right and wrong, but also how other people viewed that, and then how we viewed how other people viewed that view. Again, an opportunity for everybody to learn from the actions of others, because we understand that not everyone is going to go through this process. So in order to execute this, we crafted a survey of 57 questions. And like everything in the world today, this survey was put together electronically. And we circulated that survey to a large number of people who we saw as stakeholders in this process. We then proceeded forward and did both individual and group interviews with the survey respondents. And the effort of that was, of course, to clarify things that we saw in the survey that were confusing to us, but also to drill into areas where we thought that there was some really important stuff brought out so that we had a little bit more meat on the bone, for lack of a better term. And then all of that information was compiled, and to the extent that some of the information was objective and could be statistically analyzed, it was looked at. Where it was subjective or narrative in nature, it was compiled and tried to be summarized and ultimately crafted into this report for distribution. Clearly, it's important to recognize that this is nothing more than a bunch of papers to go on a shelf or to be stored at a website, unless people look at the document and find its content valuable and use it in guiding their own actions in both the short and long term, which we'll talk about in a little bit. So we don't view the process of the mid-action report as being done now that the report is delivered. Really, this is only the first half of it, and the second half of it is the using of the report to craft improvement in what folks in our community are doing. Just very briefly to go over who our participant stakeholders were, as I think a couple of the commissioners mentioned, we received about 140, specifically 137 surveys back of the 283 that were sent out. That was a 58% return rate on the surveys, representative of the subgroups that are listed there on the slide that I won't read over. We we want 100%, but I got to tell you, we were pretty excited at about 60%. It's traditionally very hard to get responses to these types of things. We anguished over whether the survey was too complicated and too lengthy. We know that everybody's busy, and we know that we've gotten requests for input from other agencies and looked at it and said, oh, geez, how do we find the time now to do this thing on top of everything else because everyone is so busy? But at the end of the day, we believe that the survey that we crafted really represented, the minimum that we could get to in order to get a flavor of what went on here. I believe that I said it a couple times in our discussions and lead-up meetings. This is a complicated concept. It's an unprecedented response, as I've said numerous times. Clearly, a survey that addresses that response is going to have to be somewhat lengthy. So it was what it was. We had a 60% return rate, and we're incredibly appreciative of the time that the stakeholders took to get back to us and provide their input. In the report, you're going to see that one of the sections that we look at is what we call the highlights of actions. And this is really just an ability to kind of talk at a 30,000-foot level about the response to COVID in the Berks County community. And one of the things that we recognize is that it seems that everybody's response was really based on a balance of normalcy in the community versus absolute mitigation of the disease. And for folks that watch this, that tune into the commissioners' meetings, I'm sure people have heard me kind of tongue-in-cheek, if you will, say as an example that we could obliterate the disease in the matter of 45 to 60 days. All we have to do is all lock ourselves in our bedrooms, not come out for 60 days. Sadly, some folks who have the disease would die in their bedrooms. Others would recover. Others would never have had it. But at the end of the day, in essence, the disease would be eradicated because it would have gone away in those 60 days. Obviously, that's not realistic. Our society can't stop in that way. We have people that need to be cared for. We have critical functions that need to go on. And therefore, all of this was, of course, about how do we do as much as we could in the normal way that we do it and balance that against prudent measures that we could take to put in place mitigation measures to stop the disease from spreading, and where the disease did spread, to stop it from having significant impacts on those that were affected by it. Unquestionably, I think that everyone would agree that it is what sounds like a reasonably simple question that has created so much consternation in our society, both in how people respond to this and what they're willing to do, as well as spilling over into our political arena, that this has just become so very polarized. But it is a legitimate area of gray, a legitimate discussion point that people who are good intentioned on both extremes can have reasonable opinions about, but we've got to find our way to the middle and get to a reasonable place between those two to protect our community. And I don't just mean Berks County, I guess I mean the world, because the problem is a worldwide problem. So we also recognize that a significant need in the community was the communication of what were complex and rapidly changing ideas. I would imagine that most people who would view this would admit that there are terms and concepts that they perhaps knew almost nothing about in March of 2020 that today they're able to speak about somewhat fluently. And that doesn't mean they're experts or scientists, but it means that we've learned things that perhaps we didn't understand previously. And that goes for how our economy works. It goes for how disease processes work in so many different areas. And we had to get all of that information out to people from all different sources in all different ways. And then further challenging that is that sometimes we would get that information out and then the experts, that's an air quote sometimes, the experts would realize that maybe the information that we had gotten previously now needed to be updated or corrected. And we almost had to change that information. And that really, of course, again, created a lot of consternation within the community among all different sectors, including the general public. But it was an important challenge that had to be addressed by many, many different partners in the community. Clearly, the availability of protective equipment and supplies was a huge matter for us. Anybody who was involved in the delivery of healthcare, even down to grocery store clerks and gas station attendants, people who normally we would never think about needing protective equipment, were suddenly in a position where to be able to do their job, their leadership, their governance of whatever nature it might be, needed to figure out reasonable ways to put protections in place for those people, whether it was actually personal protective equipment that they wore, or maybe it was sanitization supplies, or maybe physical changes to places of business or places of government in order to provide a degree of protection between the individuals and the public they were serving. Cooperation and coordination of activities, certainly a huge matter. In my mind, generally there'd be a big emergency in the county and we would have a supermarket chain donate ice, or water would be delivered or something like that. Maybe a major business would make a significant cash contribution to their local emergency response entity. But the cooperation and coordination and engagement of non-governmental organizations, what are commonly referred to as nonprofits, as well as our private sector community during the COVID response has been absolutely unbelievable. Things as varied as the kinds of donations that I talked about, to assistance and cooperation to getting material out, in essence, leveraging these groups to be kind of the ability to magnify into their workforce to help get the word out to large numbers of people. Down to individual small businesses who had things like 3D printers, being able to print face shields for personal protective equipment, or small garment manufacturing shops being able to take water-resistant materials like Tyvek house wrap and sew them into isolation gowns for our emergency responders back in the beginning, when that was a material, meaning the isolation gowns themselves, that were extremely difficult to get. Unbelievable, unprecedented cooperation and coordination of those sectors of our community that generally we don't see playing such a significant role in emergency response. And then finally, it goes without saying that this represented an unprecedented ask of individuals, families, and small private businesses in a way that's never before been understood. I mean, to speak very bluntly, folks, we in the emergency services very frequently have difficulty getting, 5 or 6 families to do what we ask them to do and to work with us when it comes to things like evacuating the structures in proximity to a fire, or sheltering in place for a hazardous situation like an active shooter or a hazardous materials incident. Here, we asked, again, I talk about it in the county context, but we asked the world to live their life differently and be part of the response to this community effort. Clearly, never before seen outside of this response in our lifetime, certainly, perhaps never since World Wars, where we asked people to step up in that way. So moving beyond the highlights of the response, again, the first thing that we looked at is really the communication piece. And we were able to get some pretty interesting data about the county's web presence. And this is one of those places where we really don't have insight into what happened in every sector of the community or how every entity helped to magnify the message. But we were able to look at our own web data and see that the county DES webpage, which is how we started trying to get this information out in the very beginning of the emergency, has seen about 70,000 clicks since the beginning of COVID to when this report was finalized in the end of December. Over 50% of those clicks coming from unique IP addresses, so representing people who were going here for the first time to try to find that information. Early on in the emergency, the county, specifically the commissioners, recognized the need to have a more directed methodology of communication about this. And there was a transition to the Do Your Part Berks webpage, and we tried to get people moved from going to the DES webpage over to Do Your Part Berks as kind of the single COVID clearinghouse for Berks County. And that webpage saw an additional 34,000 clicks, with over 90% of those, again, being from unique IP addresses. And that page continues to operate today and is the place, as we showed in the link, that you can go to get the actual report that we're talking about in this presentation today. So in no way, shape, or form did we see that the county government was the sole source of information, or even the originator of very much of this information. In many cases, we were trying to reach out and consume information and put it into another form to make it easier for the citizens or business owners or other entities in Berks County to consume, and we were doing that through this process. we were very surprised, this is a little bit of a preview of something we're going to talk about, at how many organizations cited the county as being the means by which they got much of their information. That was, of course, exciting to us, but I will admit that when we were putting some of this out there, I got to say that we were scratching our heads saying, are we doing the right thing? You know, we're worried that we put information out there and then the organization that originated it updates that information and we miss updating it. Does it get bad information out there? It really took a lot of work to try to stay on top of it. We weren't 100% successful. We've had failures in that regard, but it was great to hear that people felt that it was valuable to them. Another means of outreach that the commissioners implemented very early on was what we came to refer to as the COVID Resource Center. Quite early in the response, back in the middle of March, the commissioners saw the need to make sure that we had a telephonic and email means of communication for folks in Berks County who were confused about what they were hearing, who had questions. And we certainly saw that the number one purpose of this resource center was to answer questions that people had about county government operations, particularly as we modified our normal government operations in light of COVID. We wanted to make sure that people who didn't know what to do with jury duty or didn't know how they were going to get some important paper filed that they would normally file in the courthouse given the altered operations had a place to go to get that. But frankly, this also became a very important means for people to ask questions, in some cases, medical or scientific questions about COVID or about the bigger picture COVID response and the shutdown processes. And again, we did the very best that we could to not overextend ourselves as far as our knowledge of what was going on. Where we got questions, we weren't afraid to say we didn't know or refer people to other resources. But the folks that volunteered to man these phone lines and these email accounts, as you can see, answered almost 3,000 phone calls and addressed over 750 emails coming in from people with those types of questions. And while the phone call portion of this was decommissioned, I believe in late May, as we started to see that volume go down, the emails are still being addressed as frequently as possible by a number of people in county government who are trying to make sure that people who make these inquiries have an opportunity to have responses to their questions where we can facilitate that for them. The next section of the report, if you view it, it talks about some of the survey response highlights. And again, these were very complicated concepts, lengthy discussions in meetings, and we tried to break this down into a narrative type format by general discipline group. And just to hit on a couple of those, our county agencies, of course, generally refer to county government for guidance and information. That makes sense. They're part of the county government hierarchy. They would look to the county leadership to do that. But there were definitely some interesting cases noted, particularly in the form of our jail and aging, because of the very unique type of business that they do in those organizations. They also formed great partnerships with counterparts in other counties, or for example, in the jail with the State Department of Corrections, in getting best practices, sharing things that worked, things that didn't work, and understanding how to better access resources. So while county government was undeniably the number one means that they sought information and guidance, we saw numerous department heads and department management teams go outside of that norm to try to make sure that they were providing the mission that they provide in the best way that they could. We heard that throughout county government, the ability to operate was very varied. In some cases, people were able to do things like they always did, in the way they always did, and in other cases, there were significant impacts to their operations. And that's certainly understandable given the diverse mission of county government agencies and how many different types of things are done within county government. Oops, sorry about that. Sorry, sensitive scroll wheel. The next group that we looked at were local government entities. They again indicated that they generally were referring to state and county government for guidance and that they felt informed throughout the incident. They felt like they were getting the answers that they needed to get in a reasonable amount of time. And I would argue that anybody in any of these categories that said that they felt informed and were getting what they needed, as much as that means that they were well served, it also means that they positioned themselves well to understand the complexity of the situation. I don't think that anybody could reasonably say that they got everything they want when they wanted it, whether it was information, physical materials, or anything else. So generally, I think that people that said that things went well answered that question in the context of understanding that well in the COVID pandemic world was not what we might have considered well to be in November of 2019. These groups also indicated that they had significant operational impacts. They spoke very heavily of virtualization of their operations, employees working from home to meet constituents' needs, and in particular in our government entities, conducting their official government business using electronic media, virtualized meetings in order to make sure that they were being transparent and open to the public, but still being able to get the important work of the government done. Excuse me. 40% of the local government respondents indicated that they had an existing COOP plan that they put into place. And the vast number that did use their COOP plan said that it was effective in guiding them in what they were doing through the emergency. Our fire organizations had...
Please define COOP for the listeners.
That's a great point, Commissioner. Thank you very much. COOP is an acronym that refers to as continuity of operations. And more specifically on the government side, they're sometimes called COG or continuity of government plans. And a COOP plan is a concept that has been fairly common for many, many years, but in specific, going back to Katrina, I believe that it really got some kind of headlines where we had an emergency in the form of that hurricane that was very impactful to many different sectors of the community, and people were not prepared to get themselves back stood up again. And it was really at that time that we began more talking about hazard mitigation and continuity of operations and the importance of having those things. In fact, today there are many sectors of the community, IT and communications, for example, that wouldn't think of not having a COOP plan. And in some cases, there are regulatory obligations placed upon entities that service critical functions in our community to have them. So, in government, there is not a mandatory, there is no mandate that you have a COOP plan. It is highly recommended as part of the National Incident Management System. But I believe that the responses here indicate that those folks that had them felt that they were important and helped them a lot. Thank you again, Commissioner, for pointing that out. The fire discipline, the fire responders who answered our survey, a couple of which were departments of local government, such as Spring Township and the city of Reading, but vastly our fire respondents in Berks County are private nonprofits that we view a little bit different than we view other nonprofits because of the pseudo-governmental role that they form or that they serve. So we looked at them in a separate category. They were mixed in their opinions on the efficacy of state support. In most cases, they indicated they were satisfied with the county support, with PPE being universally noted as one of the places that they felt the county well performed for them. Many of them indicated that they implemented alternative procedures, particularly in response to how they go out and support QRS and medical assist calls, which are support to EMS, where primarily the means or the need of the emergency call is for an ambulance, but there's an additional need that requires fire department responders to come out and help the ambulance. They're referred to as QRS or medical assist calls. And in those cases, they significantly modified their operations due to the hazards related to COVID. Also noteworthy are changes that were made in the PSAP, or the Public Safety Answering Point, the 911 center side of these operations, where we began collecting some additional data and information in order to ensure that our responders were as reasonably safe as they could be. And I will tell you that the public, justifiably so when they have an emergency, are not always satisfied with having to answer other detailed questions that they see as unimportant, but that we believe are important in making sure that we're protecting our emergency responders. But again, an alternative procedure that was implemented to help to serve these folks. The EMS side was particularly complimentary of county efforts. In fact, a number of the multi-county EMS operations noted superior support levels in Berks, and the fact that it really represented kind of a case study for how some other counties could support their emergency services, their emergency medical services operations. It was also worthy to note the incredible cooperation of those EMS agencies working together with their affiliates through what came to be called the Joint COVID-19 EMS Task Force. And this was a group put together by our county EMS managers who met and are still meeting on a regular basis, weekly, in the beginning, actually daily in most cases. And these entities, really recognizing the need to take care of themselves and to service their own needs, began working to share resources, to share best practices, and also to get the word out about important changes in processes and information to other affiliates in the community like fire, like law enforcement. And again, this group is still actively working today and really represents a model best practice for how groups, for how a discipline, for how disparate organizations really serving the same mission can work together to ensure that they're doing everything they can to meet their needs cooperatively. On the law enforcement side, they indicated that they were generally referring to county government for guidance and information. They did note a very high level of coordination between law enforcement leadership, the chiefs, if you will, and county government of all levels, not just DES, but the sheriff, the DA's office, who all participate in countywide working teams on these issues. They also expressed a high level of satisfaction with the quantity and type of PPE that was made available to them throughout the emergency. There was a significant notable exception. The Reading Police Department generally disagreed in these matters and found that the county support was too late and inadequate given the emergency that was upon us. That of course is very concerning to us, not just because it's an organization that strongly expressed dissatisfaction, but because it's the largest law enforcement agency in our county and the agency serving our metropolitan county seat. So we'll talk a little bit more about the outcomes of that, but we wanted to make sure to note the negatives along with the positives. Next grouping that we talked to were short and long-term care facilities. We think of these as, skilled nursing homes, assisted living facilities, group home type operations. These organizations are generally private entities, in some cases for-profit businesses, in some cases not-for-profits. And as would be expected, they indicated that they were primarily guided by their corporate structure. But much of the kind of government guidance or government information was getting distilled down to local operations through a bigger corporate structure where these entities were part of a bigger, larger machine. They also indicated that they relied very heavily on that corporate structure for resource support, the ability to go out and find materiel through other means that were not normal, and to surge in those materials where they were needed urgently. There were strong issues noted with personnel availability. Of course, we know that these entities were ravaged in the spring initial COVID impact. And not only were the residents sadly ravaged, but the employees were also, with vast sickness and need to isolate due to suspicion of illness or exposure to illness. That was a huge impact for these groups. And of course, that always trickles down to money impacts also, because that meant having to bring in agency support or pay folks unanticipated overtime, which of course has an impact on the bottom line, and ultimately the money available to make these groups, these organizations, the best they can possibly be. They indicated a very high lack of awareness of existing state, regional, and county support structures that are intended to serve these organizations. And again, that's something that we'll be illustrating on the back end of this discussion as a lesson learned or opportunity. The next group that we talked to were those nonprofits or non-governmental organizations. Most of these organizations indicated that they were using county-produced materials for policy development. So they were reconsuming information that was being pushed out at the county level and helping them to work through what they needed to do in their organization. They were largely complementary of county efforts, and they indicated a great deal of reliance on each other for physical and personnel support. And I talked about it a little bit in the beginning. But this group, unlike many of the other groups that we talked to who got to also experienced that summer lull indicated that they either saw no lull or in some cases actually saw an increase in the needs expressed by the constituencies who rely on them for services. And that means that these groups, unlike many, really have been working at that 100% level since March of last year and continue to do so today, which is not easy for them. Our next group was acute care hospitals. Of course, in Berks County, we only have 2 acute care hospitals that are geographically located in the county. They are Tower Reading and Penn State St. Joe's. We have incredible service from surrounding hospital facilities. We have people that come from other counties to our hospitals. We have people that go from our county to other hospitals. Lehigh Valley, St. Luke's, Ephrata, Lancaster General. All of those are examples of facilities in neighboring counties that service our population here in Berks County. But our focus was on our 2 geographically located acute care facilities. They expressed a great deal of concern with state guidance and direction, it constantly changing, being very confusing. And that's not to say that the state was 100% at fault for that. The environment, the situation was constantly changing and very confusing. But our acute care hospitals did indicate that they had a great deal of difficulty consuming and comporting with state-offered regulation and guidance in that regard. They expressed a concern about the state's unprecedented change in what we refer to in emergency management as the unmet needs process. And this is basically the process by which lower levels of entities, either private sector or private nonprofit or lower levels of government, look to higher levels of government in order to be serviced with unmet needs necessary to fulfill community emergency obligations. And I don't believe that we could spend, I could probably spend an 8-hour class talking about logistics and emergency management and the unmet needs process. But very simply, the way the process usually works is that when you have an unmet need, you raise that unmet need to a certain level of government, depending on the emergency. And then if that level of government is not able to meet it, it's escalated through other levels of government in an effort to try to satisfy you. In the COVID emergency, that's called a pull process. We ask for something, we pull it from where it's available. In the COVID emergency, this was switched with very little notice or explanation to what was called a push process, where material was simply pushed out from higher levels of government down to lower level governments or entities without being asked for based on a belief of what might have been needed. And this unfortunately resulted in there being a surplus of unneeded materials, while there was a lack of needed materials with no clear way to understand how we were supposed to tell those other levels of government that we had those unmet needs. And in many cases, we were unable to meet those needs at the local level because vendors that we were going to buy these things were saying to us that all of their stock was being reserved for federal or state contracts. So the feds and the state were buying everything, no matter how much money we were willing to bring to bear on the problem. There were things we couldn't get, yet we also weren't able to get those things by asking for them from the state and federal government. And that was definitely a real problem as we went through the spring. It was identified very clearly by our acute care hospitals. It was also recognized by us playing the role that we play in emergency management at the county, but definitely impactful and definitely something that needs to be looked at going forward. These entities worked with the county very early on to do cooperative purchasing. There were cases where they were buying things and we were able to jump in on their order in the interest of serving some other entities outside of the acute care hospitals, like our emergency responders, and vice versa. There are places where we were making significant purchases that we were able to allow, that we in essence bought for the hospitals and then, for lack of a better term, resold it to them, of course at no markup, when we received the materials in order to allow them to access best prices or availability of product that we were able to find that they weren't. These organizations leaned heavily on their own plans for surge management being a large influx of patients that are beyond what would be normally anticipated. And this is an example of kind of a COOP plan where these organizations are regulatorily obligated by the Joint Commission on Accreditation, the organization that basically says that hospitals are doing what they're supposed to be doing in the right way. They're regulated and required to have these surge plans. They, of course, leaned on those surge plans. They're well developed, and as we can all see, have helped the hospitals to respond to our community need from the beginning of this and through today. This is the flatten the curve concept. These are the things that we keep trying to instill in the public. While there are plans there, while the hospitals are doing everything they can, we need to minimize the impacts to the hospitals because these plans are not infinite. They can't grow the patient surge to the X extent. There are limitations on what the hospitals can reasonably do. And it was also noted that the hospitals do have seen and expect to see further attrition of staff due to the incredible stress that their staff has been under throughout this emergency. Both risk to their own health, the illness or death of workers in our healthcare systems, as well as just the mental and emotional toll of dealing with what they're dealing with day in and day out as people are suffering and sadly dying from this disease. The last two groups are higher education, who indicated that they generally rely on PASHE, which is the PA state system for higher education for guidance. Again, this is very much a kind of a regulatory thing where they generally answer to PASHE and therefore, of course, look to them for information. They did express that they saw a great deal of discrepancy between the guidance that was coming down from CDC and DOH and what they were getting from PASHE and PDE, or the Pennsylvania Department of Education. That was indicated as something that was concerning. They felt that there was some mixed messaging there. They also noted a significant lack of physical materials to facilitate the reopening. Of course, many of these types of organizations shut down in the spring, were shut down or didn't conduct their summer sessions through the summer, and then as they began to try to reopen in the fall, were running into significant problems with material availability to allow them to reopen safely. And then our K through 12 education group, our kindergarten through 12, public, private, parochial schools, not all of which responded to our surveys, but in the case where they did, we heard enormous praise for the BCIU. And I've sat in on calls with our superintendents and the BCIU leadership. They are a beyond incredible partner in helping to organize that group of our community. And of course, each of our school districts governed by a local school board are a unique and independent government entity that in very much decides their own processes, decides their own fates, of course, under the guidance of requirements of Pennsylvania Department of Education and the U.S. Department of Education, but they have a great deal of autonomy. This opportunity to bring those senior leaders of those districts together under the BCIU so that they could collaborate, talk to each other, bounce ideas off of each other in a safe environment, and get lessons learned from each other, absolutely incredible, and continues to go on today. And unquestionably, it is BCIU that is the central cog in that machine that makes all of that work. So on the back end of the document, we of course show all the questions that were asked in the survey, and where those questions were able to be answered objectively, we have some graphics that help to display them. Where the questions were answered more subjectively and in a verbose way, we incorporated the responses into the narrative of the plan. And I don't want to take the time today to go through every single question response that was objective, but I do have just a couple slides that I thought were very interesting, and particularly how there were interactions among questions. And this first three here relate to the county's community pandemic plan, a document that has been in place since approximately 2009. There is a pandemic advisory council that is representative of members of our community in various sectors, as well as just private citizens who have expressed a great deal of interest in this matter, who on an annual basis work with my team to review and update that community pandemic plan. It is on our website today. I will acknowledge that one of the things that we saw is that the community pandemic plan was really written around the pandemic influenza response, because prior to COVID, that was what all of the education and belief was about, that we would see pandemic influenza. After COVID, in the late spring of this year, we again revised that plan, very coincidentally, having nothing to do with COVID. The normal annual revisit and revision of that plan is in the early spring of the year, and the plan had literally just been touched and updated prior to COVID becoming a serious problem. We touched that plan again just a few months later out of the normal annual revision to recraft it into what we're now calling an infectious disease operations plan, because we wanted to make sure that we recognize the possibility of infectious disease outbreak outside of pandemic influenza in our community. But nevertheless, going back to the pandemic, the community pandemic plan that was available in the spring, we saw that over 75% of the respondents were aware of the existence of that community pandemic plan, but only a very small number, about 50%, used that plan to guide their preparedness actions. So they knew it was there, but they didn't really utilize it in their preparedness work. But of those that did use it, on a scale of 1 to 10, there was a response on average of 6.5 who felt that their usage was useful in guiding their actions. So I would interpret those 3 slides together to say that there was a fair percentage of our community who knew about the pandemic plan but didn't use it. And we believe had they used it, would have found some value in that usage in guiding their actions based on the response that we saw from those who did. The next kind of sampling has to do with personnel impacts to operations as related to the pandemic. And again, here we see that only on an average, on a 1 to 10 response, there was an average of approximately 3 to 3.25 that indicated that COVID had a significant impact on their staffing, that staffing limitations were significantly impactful to them. And over 90% of the respondents indicated that they received good information about mitigation strategies to protect their workforce. So again, we would ask, is there a nexus here where we saw a large number of people saying that they felt they were getting good mitigation strategies, and it would seem that a vast number of people did not believe that staffing limitations impacted their ability to operate, given that the response was only about a 3 on a 10 scale. And then we see where various entities were leaning to in order to get information about these disease mitigation strategies, with the most significant number being through the State Department of Health. And this was a multi-variable answer. People could indicate that they were getting it from more than one source. It appears as though the State Department of Health, county government, and professional organizations and local experts, hospital systems helping to get information out through their professionals were examples of the greatest ways that people were getting information about these disease mitigation strategies. Very important thing, we asked whether organizations intended to undertake their own internal after-action review. And we would hope that this would be 100%. And we know that that's going to be at kind of varying levels of fanciness or formality, if you will. But we would hope that everyone, a corner store, that operated during COVID, that they might take a moment to reflect back on what happened, what they did, and how their operation could have been different. Clearly, the way that they do it and the answers that they have are going to be very different from the internal after-action review conducted by Tower Health. But nevertheless, just recognizing the need to do something like that and doing it to the extent that they can, we believe is important universally throughout the community. We also asked whether organizations were preparing for a fall-winter resurgence, and we were pleased to hear that 90% of the respondents indicated they understood that they needed to have a higher level of readiness for the fall-winter, and were preparing by stockpiling physical materials in anticipation of that need. Again, 90% of respondents indicated that they were doing this, and almost 90%, not quite, but almost all of them indicated that they felt that they would be adequately prepared. And again, I think we have to put that in air quotes. We, the county, don't know what we're still facing yet as this continues to move forward. How long it will take to get vaccines out to people, whether new strains will come that the vaccines are not as effective against, what the public acceptance of vaccination will be. Will we be able to bring this rapidly to a conclusion, or will we have a protracted second wave, and God forbid another summer lull and a third wave in the fall. We all hope we don't get there, but these are all things that have to be on our horizon as possibilities and that we have to be attentive to, continually maintaining the improvement of our preparedness for those future possibilities. So again, I certainly didn't go over all 50, I think it was 7 questions that we asked, but I wanted to give a kind of a sampling, if you would, of those objective questions, particularly in the ones that we found most noteworthy in the report. All of them, however, are detailed in the written report. So the final sections that we want to talk about are opportunities, and this is really the most important piece, if you will. These are our identified opportunities that are derived observationally. In essence, these are examples where we at DES, in having these conversations with all of the stakeholders that contributed to this report, saw that there were places that we as a community, again, not just DES, not just the county, but the whole community, could look to make improvement. We also recognize that we don't compel anybody. Ultimately, each stakeholder's decision-making governance body, and in some cases, that's going to be one person who's the private business owner. In other cases, it's a board of directors or an elected commission or board of supervisors. It's different for every stakeholder, but ultimately that leadership group, that governance structure, is going to have to make the decision for whether and how that stakeholder implements any of the recognized opportunities or other opportunities that we maybe didn't recognize. We broke these down into 2 categories: short term, which we saw as being changes or reinforcements to current actions and policies that could really have an effect on the rest of COVID, on what we believe to be the 2021 response to COVID, versus long-term opportunities, which are things that could not reasonably be implemented in time to change the response to COVID, but definitely also cannot be lost sight of and must be considered as part of a longer-term opportunity for our community to improve as a whole in the way we respond to all emergencies, including biological emergencies like another pandemic. So in the short term, we saw the continued provision of PPE for county agencies and emergency responders as being something that needed to go on and needed to be reinforced. We recognize the need to act as a safety net for our long-term care facilities. There's been some criticism of government in general, not just county government, but at all levels, for why we didn't make available all the PPE that was necessary for everybody that needed it. And while that may be an easy finger to point, it is clearly completely impractical, not only from every business and family that might need PPE, but even to get into critical groups like our long-term care facilities. Their healthcare operations, they have to continue to operate, doing what they do normally and protecting those under that are wards of their organizations. And we as government need to be a safety net to help them bridge gaps or unanticipated shortages in the way that we can, but we can't be a get out of jail free card for those organizations, for those entities not doing what they need to do. There was also a discussion that we need to look at the implementation of bulk purchasing. Is there anything that county government can do to act to expand on the bulk purchasing that we did with the hospitals in order to make it easier for these various organizations to get access to those types of things? Continued publication of planning templates. Some county plans are written for county government or for county government agencies, and they're not publicly released plans because they have sensitive information or they guide what is going to be done by responders in a way that could be compromised or used against us if they got into the hands of people with nefarious intentions. But other plans like the like the community pandemic plan or the infectious disease operations plan or our local government COOP planning templates are examples of plans that are very valuable for us to do work on development and then to put out into the community in a template model to have people consume and build on or make more refined in ways that will help them respond to future emergencies. We want to make sure that we continue the publication of those kinds of template plan documents in ways that will help other entities in the community. The collaboration of fire and law disciplines using the EMS COVID task force as a model. We have for a very long time had law enforcement working groups and fire working groups, which are kind of representative democracies, if you will, of groups that get together on a regular basis to talk about important things for these disciplines. The EMS COVID task force model really brought to light the fact that getting every stakeholder organization at the table together was an important thing to do. And perhaps it wasn't as easy to do before we all recognized things like Zoom and Teams and the kind of things that we're doing to conduct business today. You really can't get a representative from 62 or so fire companies in the county all together in one room and have an effective discussion at one time. But bringing those people together in a Zoom type platform or a Teams type platform does seem much more realistic. And this outreach has already begun from the COVID task force, where they're inviting not only leadership of fire and EMS to the table, but even having other calls during the week where all staff members down to the rank and file members are invited so that their voices can be heard. Great model that should continue to be reinforced. And we also believe that in the short term, we need to have a meeting among key city and county stakeholders to address the disconnect that resulted in the Reading Police Department's dissatisfaction. It's very troubling that we heard high praise from city fire, EMS, emergency management that wasn't echoed in the police department. And we believe that by getting city leadership, county leadership, our department, city police leadership, and city fire, EMS, emergency management leadership together, we can get to the bottom of what's happening there, why it's happening, and make it better for everybody moving forward. So those are the things that we really saw as being the short-term opportunities that we should try to work towards. Then we get into some of the longer-term ones that we recognize need to be a little bit more on the middle or back burner. There clearly needs to be a thorough examination of the unmet needs process, and we as the county emergency management agency recognize a role in conjunction with the commissioners in calling on the Commonwealth to form a working group that will define, plan, train for, and assure the implementation of a clear unmet needs process moving forward. We recognize that perhaps the unmet needs process that existed needed to be changed. Maybe it wouldn't have worked in the magnitude of what we were confronting, but that means that the process then probably wasn't as well planned as we all believed it was in the beginning. And if there was a need to change it, it doesn't seem that the wholesale change to a completely unanticipated system was the way to get that done. So we hope that we can partner with our counterparts in other counties and the Commonwealth, perhaps through pressure from the County Commissioners Association of Pennsylvania on state government to work with us to ensure that we get to a place that doesn't happen again. We, the county, recognize the need to further evaluate our social media presence and expand that presence into other areas to improve reach into the community, both into constituency groups as well as into the general public. And the commissioners, recognizing the importance of communications, have brought on board a county public information officer. Stephanie Weaver was brought on board in the middle of this mess, and God bless her, not only coming to a new role for her, but a role that didn't exist in county government prior, and doing that in the middle of a community pandemic. Her work has been cut out for her. I don't believe that she has slept more than a few hours a night since she started with county government, and I don't perceive that she's going to be getting very much sleep for the next few months, if not the next year, as she works to help the county to get its communications mission squared away. And then finally, the evaluation of all response deficiencies and consideration to which of those deficiencies and to what extent would have been mitigated by the existence of a county health department. We need to seriously ask the question as to whether a county health department would have helped to make this situation better, and given the investment that would be necessary to create a county health department and all of the other responsibilities and liabilities that come with a county health department, would this have been a solution, and will it be a future solution that could have better protected this community? The answer is we don't know right now. We certainly believe that there are areas where having a county, from my perspective as a leader in county government, having a county health department director that I could pick up the phone and call that has expertise in infectious disease and these types of public health concepts would have been incredibly beneficial to us. But there are also many areas where we've seen neighbors with county health departments who struggled as much as we did because of the lack of clarity about what needed to be done. So it is while we don't know that the answer is a county health department, we are very confident that the consideration of a county health department and how it might have affected this pandemic is part of the long-term things that we need to begin addressing. We also recognize that all stakeholders must be prepared to protect their employees and wards. And this kind of comes back to what I said about the long-term care facilities and government acting as a safety net. I believe that we are going to have materials on the shelves in the warehouses of businesses and private nonprofits and governmental organizations that we never had previously and never had certainly in these volumes. Going into this pandemic, we had stockpiled N95 respirators, respiratory protection, but had not anticipated a need to have things like gowns and eye protection on hand, and certainly not to the volume that we had any of it, that we had the need for throughout this at any time. That clearly is going to change in county government, and we significantly hope it's going to change in all facets of our community because, again, everyone has a role to play in this. Everybody's got to be able to do something from the get-go, not just immediately throw their hands up and say, I need help. And the final slide, 2 points, the further evaluation of opportunities to provide guidance to groups from the county level. This is a many-to-many concept, not a one-to-many concept. We as county government can't provide guidance or direction to everybody in the community. We've got to be able to work through advocacy teams or constituency groups. There are areas that we recognized that because the advocacy group or the advocacy structure for certain groups doesn't exist strongly in our community day in and day out, when this emergency came upon us, it was unclear where those groups could go to be advocated for, or even where we as government could go to try to serve those groups. And I think that we're going to see changes moving forward in the organization of these advocacy groups under county departments, or in some cases state and local government departments, where previously it didn't exist. Almost every one of these advocacy groups, every one of these constituencies is going to have to be recognized under some department and level of government where we can say, well, maybe we don't give them millions of dollars, and maybe we're not out there doing what we do for them moment by moment, day in and day out, but they're at least the group that we have contact with. And when we need to service them, this is the channel by which we're going to service them. I see there's going to be big change in that regard moving forward as a result of this pandemic. And the last point is county engagement with healthcare institutions and the Department of Health and their contractors to assess the healthcare coalition model, to consider whether that model needs to be improved or replaced. This goes back to the broad lack of awareness among our healthcare partners about the healthcare coalition model that is supposed to be there to serve them day in and day out, as well as during emergencies like this pandemic. And we need to really get to an understanding of why did they not understand it was there? Why was it not marketed better? Why were the concepts that it was supposed to be promoting not being promoted better than they were prior to this pandemic, and how can we stop that and change that in the future? That really encapsulates both the short and long-term opportunities that we recognize. The very last thing we want to talk about here is the AAR, or the after-action review opportunities. This is circling back to the beginning where we recognize the mid-action review being kind of a different flavor of an after-action review, and the fact that it's likely that an AAR should be conducted for this. How that AAR gets conducted, whether it gets conducted at all, and how it gets conducted is really a decision for the Board of Commissioners. We need to answer the question of yes or no, are we going to do it? We need to understand, are we going to expand or contract this in both in the scope, in the number of participants, and in the methodology of how it's conducted? And then ultimately we need to decide whether there's going to be an internal or external facilitation of that process, some of which is really going to be driven by the expansion or contraction question, and whether we have the capability to facilitate that internally, either in DES or through another part of county government. No matter what county government does, I hope that everybody that views this or hears about this will take advantage of the concept within their four walls and conduct an AAR, if you will, of their own operation, and try to build on and learn from what it is that they did throughout the beginning and now this second phase of the pandemic. So with that, Commissioner Weinbach, you are back online now after your technical difficulties, and I will turn the show back over to you to see if there are any questions from the commissioners or from the public at large that either Matt or I can answer for you.
Thank you very much, Brian. Thank you, Commissioner Barnhart, for jumping in there at the last minute. And I think what we should do next is literally open up for questions or comments from the commissioners. I do not see any questions on the Q&A right now, but my colleagues, any comments, questions?
Very thorough analysis. I read through it several times as it was going through draft form, and I think Brian did an over-the-top presentation today. Thank you.
Great. Commissioner Rivera.
No questions, but as well want to thank Brian and his office for putting this together. Very well thought out, reached out to, again, 140 responses. That's excellent from the different categories of key stakeholders and from community sectors. So really a great job, very informative, and looking to do this again once COVID is done, and the sooner the better.
Yeah, absolutely. And Brian, I think that this is the most definitive report I've seen thus far at any level. This is the kind of thing we need to look at. And as you noted, we need to hear the good with the bad. If we're really honest, we learn more from our mistakes. We get better when we get that kind of feedback. So we not only want people to give us feedback, we want to hear the critical feedback as well. We hope people will do it in a spirit of, let's do better. We're letting you know, not to make you look bad, but because we want to improve in the future. So with that in mind, the last slide, my answer is yes, we do need to do an after action report. Not doing it doesn't make any sense. As far as the scope, I do not believe that the scope of this mid-action report was unusually large or broad. I think it really reflected our community. Obviously, you had 2 school districts out of 18 school districts. Would I'd love to have 18? Sure I would. But at the same time, I guarantee those 18 districts had a lot of other choices, and we had 2 schools. We had a number of long-term care facilities. We had local government response. So I was very, very pleased with the variety of entities that responded, especially when you consider how many questions they were responding to. It's easy to get, 5 question survey, and I'm not going to get into the veracity of 5 questions versus 10 times plus that, but it's very clear to get the kind of information we need and you need. It was going to take a lot more questions. So I think it was very good. You need to really tell us, not this minute, but I think you and Matt, Matt really took a lead on this effort. And at the end of the day, it's the key people on our team. But come back to the commissioners and recommend, do you think it needs to be a little larger? a little smaller? Is it just about right? And then let us know, is this something that you believe you have the capacity to do, whatever it is that you recommend? At least from my standpoint, I'm going to support what you recommend.
I know in the annals of survey responses, 60% is phenomenal, but I would suspect our job as commissioners should be really to promote when there is a final action report, to get it out to let's get 18 school districts, let's get 72 municipalities, let's really push it out and make sure that we get a much higher response. Even though 60% is great, I'd certainly like to see something in the 90% range.
Yeah, I appreciate that, Commissioner. I think you know that I will, of course, be open and honest in my assessment of what we need to do and how. And I also appreciate that you're not looking for that answer now, because I don't believe now is the right time to give the answer. Sure. I think we need to get more of this second response period under our belt, and we also need to hear more from the stakeholders, and maybe even those who were not stakeholders, who got the survey and didn't respond, or very honestly, who we overlooked. I have no doubt that there are entities in the community that are going to raise their hand and go, hey, wait a second, why didn't you survey us? And our honest answer is going to be, we didn't think of it. It's a great point. We probably should have. So I think that part of the answer to the AAR concept is going to be, what do we hear back from the community about the value of this effort, and what do we hear back from the community about what they want the rest of the effort to be, whether they want the AAR concept to be something bigger.
Yeah, without a doubt. But again, I've been so impressed with you and your team. You stepped up in the very beginning, and I just want to note this. You've been leading the Berks County COVID-19 team since mid-March, shortly after the declaration of an emergency on March the 12th, I believe it was. And I don't know where we would be without you and your team interfacing with the hospitals, interfacing with DOH, the Pennsylvania Department of Health, interfacing with the Pennsylvania Emergency Management Agency, and a variety of other local partners and agencies. We rely on that kind of connection and work from the Department of Emergency Services. That said, I don't think most people realize the kind of impact a pandemic would and does have on a department like yours. I mean, you went into 2020 with really no clue that a vast majority of the year would be absolutely taken over by a pandemic called COVID-19, and we're not out of the woods yet. We don't know where we are exactly. We know that in Pennsylvania and Berks, we're in an uptick. We'll see that tomorrow in the COVID-19 report, and an uptick, not so much of cases right now, but hospitalizations, people on ventilators, deaths, unfortunately. And on top of all of that, we're dealing with the rise of this new strain here in the United States and in Pennsylvania, and the potential fallout. As I shared the New York Times article this morning talking about some concerns with that. So we need to stay vigilant. Hopefully the mid-action report really was the middle. But we don't know that at this point in time. And again, thank you to you, Matt, and your entire team. I know Sean Hart has been very involved in this. Please take that back to the team to encourage them that we realize the amazing amount of work that they are doing.
I appreciate that, Commissioner, and thank you very much for recognizing that it is a whole team approach, and there are about 85 people who work in the Department of Emergency Services kind of full-time at our office. That's not including our fire training center, our hazmat team. And many of those people are in the communication side, handling 911 calls, handling communication for our emergency responders. And maybe they weren't involved in writing a report, or they weren't involved in a conference call with DOH, but every one of those people has played a huge role in the county's response to this emergency, has been at work every single day, except when they're not supposed to be because they're isolating or ill, but have done so irrespective of what's going on in the community, the risks that are posed to them, and have done it because of the commitment that they feel to serving not only the general public, but also our brother and sister emergency responders who are out there on the front lines doing what they do. So I do really appreciate you recognizing that, you know, even though I'm the face that you're forced, unfortunately, to look at every week, there are a lot of people behind that face that are really getting this job done.
So, well, thank you very much. Those that are viewing live, at least, I would encourage you to tune in tomorrow to the Berks County Commissioners Weekly Meeting. It's at 10 a.m. It's on BCTV, also on their website, bctv.org, on our Facebook page, on our YouTube page, and also on Microsoft Teams. And with that, we will close our program. Thank you for joining us. Thank you, I would say, to our guests, but in this case, to our guest, Brian Gottschall. You did a great job presenting a complex but very important report. Thank you.
Thank you.
Thank you.